Hi, I'm Dr. Padmapriya. I'm an obstetrician, gynecologist, and laparoscopic surgeon at Cloudnine Hospital, Hitech City, Hyderabad. Uterus rupture can happen during normal delivery. There are two situations where it can happen. One is if there is a scar on the uterus, like if there was a previous cesarean delivery, where there was a hysterotomy, that is a second trimester abortion by opening the abdomen, or if there was myomectomy. Myomectomy means removal of fibroids and suturing the wall of the uterus. The other situation where uterine rupture can happen is in obstructed labor, which is very uncommon these days, but in rural settings it's still there, where patients stay at home for days together in labor and go to hospital in the last minute. So it can be prevented. We have to select the cases. Whenever we're giving vaginal birth after a cesarean or on a scarred uterus where there was a myomectomy or a hysterotomy done, we need to select the patients carefully. We have certain indications where we select the patients, like if the cesarean was done for a non-recurrent indication like malpresentation, if the patient gets into spontaneous labor, if the cesarean was not done in the second stage of labor. Pretty of the few indications where we select the patients for vaginal birth after cesarean. And we should also have a good hospital setup when we are giving a vaginal birth after cesarean. And in obstructive, so we can prevent it by preventing obstructed labors. We have to educate our women in our country to come to the hospital and seek medical help whenever it's required in pregnancy or labor. So before the delivery of the baby, we get to know when the baby's heartbeat starts to fall down. So immediately the patient has to be taken up for a C-section. There has to be a continuous electronic fetal monitoring of the fetus inside the womb whenever we are giving a vaginal birth for a scarred uterus. When the rupture happens after delivery, there is no bleeding. If the patient is fine, if the vitals are stable, nothing to be done. We don't have to explore the scar and see. If at all there is a bleeding, we try to massage the uterus. We try to find out from where, if there are any other tears, from where the bleeding is happening, and we use medical methods. There are so many advanced medicines to stop the bleeding. We try all this. It's a teamwork. We need to arrange for blood and blood products immediately. In case all these methods fail, then we'll have to, and the patient is still bleeding, if the bleeding exceeds 500 ml and the patient is becoming unstable, we need to take the patient up for laparotomy, and we need to find out where the rupture is and suture the site and stop the bleeding.